Hey, what's going on, everyone? This is Kevin. This is the In My Head podcast. Thanks so much for checking this episode out. I'm really excited for it. One thing I forgot to mention in my last episode, it was all about, it was a solo episode where I just talked, and it was all about having episodes of relapsing anxiety, depression, and what I did. It was kind of my experience in the past couple of months of having kind of anxiety, depression, and all that coming back in and how frustrating that can be. And I kind of talked about what I did to mitigate the symptoms. I talked a lot about exercise, sleep, diet, who you surround yourself with, social media, finding these things that you can either do more of or do less of, whatever it is that is going to help you through these symptoms and help you through these dark times that tend to come back. And the most important thing is to know that these times pass. That was all that episode was about, was getting into a mindset and experience where you have it coming up and you're like, I know what this is. And you find a way to get it under control through healthy lifestyle and just being surrounded by positivity and finding a way, whether it's going back to therapy, talking to your doctor about medication, or if you're taking a natural approach, adjusting things in your diet, whatever it may be. For me, I talked just going hard, exercise, doing all these different things. I'm still doing it and I'm still having, the good benefits. But one thing I totally neglected was supplements and vitamins. And for me, what I've noticed over the past 10 years when I've had anxiety and depression, it's been heavy, is I've started having all these physical symptoms. When I eventually do my own history episode, that for me were the first triggers of realizing I had diagnosable anxiety and depression. Was it started out feeling lightheaded or brain fog or kind of just in a dream state, like I wasn't present. I just felt weird and I thought I was just tired and all those things. And then I started having migraines. I started having pains throughout my body. And then once I was when I would go to doctors, that would be a common theme, is if you ever been diagnosed with anxiety, depression. I was like, how can that be it? Because my body just feels bad, or whatever. But then I started experiencing panic attacks, and it became a real thing, having dark depression, often most of the time. And so I forgot to mention vitamins and supplements that I was taking too, because these can have a great impact on your mental health, gut health. And for me, again, not a doctor, and I'm not telling you how to treat your own mental health problems, but it should go without saying that you can supplement, and these things pair well with a healthy diet. And so I'll just tell you some of the things I take on a daily basis, and most of them are centered around decreasing inflammation and just having a balanced set of nutrients in my body. So I take every single day breakfast, first thing in the morning. I take vitamin C. I take glucosamine for joint pain, inflammation. I take turmeric, curcumin. So those two things, I've heard a lot of people having lots of success with inflammation and even anxiety and depression. They've noticed pairing these things have really been helpful in their not only physical health but mental health, and especially with inflammation. So I'm going to forget stuff, but so I take those, and also a B vitamin complex. I take, what else? Vitamin D, because they've done studies and the majority of Americans are deficient in vitamin D, even though I get out in the sun a lot. I'm pretty sure we're all deficient in that according to what I've read. So I supplement with that. I supplement vitamin A. I don't do that. That's not for the long run. That's just something I'm doing right now as a part of kind of a balanced diet. From what I've read, you're not supposed to supplement vitamin A for super, super long terms, especially not high dosage. But again, talk to your health professionals and stuff about that. That's just what I've read. So I'm trying to think what else. I take CBD oil a couple times a day, and that for me has been huge. I do notice a big difference on anxiety levels being low. It helps with sleep. And yeah, I've really liked that. I'm trying to think if there's anything else. Anyway, bottom line is I didn't want to leave that out, because paired with diet, which for me has been huge on limiting things that increase anxiety and depression. And for me, those have always been sugar, caffeine. I mentioned not drinking alcohol. That's just a personal choice of mine. And then the foods, like not eating gluten, sugar. And again, these aren't things I'm 100% off. Like it's things I just do my best to limit. And most days I don't. This is lately too, over the past couple months. Usually day to day, I do my best not to have sugar, not to have gluten. And anyway, if you didn't hear my rant in the last episode, go back and check that out because I kind of talk more extensively on it. But anyway, I just didn't want to leave that out. Vitamins, supplements. I've just done a lot of research on mental health and benefits and what supplements help with that. Oh, magnesium. That's a huge one. So if you have experience with anxiety, magnesium is kind of a standard that a lot of people say you take daily, and it tends to help with that. I take it right before bed, and I'll even do those magnesium soaks. And especially if you have migraines, magnesium is that's kind of like what you should be taking if you have migraines. And I've noticed huge for me. I used to get migraines 2 to 3 times a week, and now I maybe get them once a month. But the ones I do get aren't near as bad as they used to be. They're still sucky and not that great, but they happen fewer and far between. And I notice they tend to come back when I slip on the things that I mentioned with diet, exercise, and all that stuff. So anyway, that's a little addition to the last episode. This episode I'm really pumped about because I say this right in the beginning of this episode. It's with Dr. Drew Belnap. He's an MD currently living in and practicing in Encinitas, California. And I was recently down there for work, and I got to sit down and have a chat with him. And I've been so excited to do this episode, and we've been trying to put it together for a while now, because I would say ketamine, this is all centered around ketamine treatments as it's not alternative medicine. He mentions that, but it's an alternative practice to typical medication for anxiety and depression. He even treats for bipolar, OCD. The one that he says he doesn't treat for is schizophrenia, and he didn't really mention mechanism or anything like that. I think he did. He mentioned it can sometimes trigger something in having these schizophrenic episodes. That anyway, he goes into it, and I'll just let the episode talk for itself and let him explain that. But I probably get more questions about ketamine, probably more that a very specific question about ketamine more than most things in this podcast. People want to know more about it. They want to know if it's a good choice for them. And I almost always refer them to Dr. Drew Belnap, who's in San Diego. There are people all over the country that practice it, but I'm going to let him explain this. And we do it very detailed on what to look for if you're trying to seek out a clinic that does ketamine treatments. But there's a very specific set of things, and I'll say it here again because I believe it's so important. The only bad experiences I've heard of people having on ketamine, he explains a couple, but the ones I've only personally heard about, aside from what he mentioned, is, sorry, that's confusing, but are the ones that don't follow this kind of standard that he talks about, and that's having a physician do the treatments. They do it by IV infusion. So you're actually getting an injection, and it's by IV. So they're doing basically an IV drip over the course of about an hour or 2 hours. It's very controlled. If it gets intense, they can throttle it back. So those are the two things. The third one is that they are present the entire time in the room with you. If you follow those 3 things, you're most likely set up for a successful experience with the ketamine treatments, because there's a lot of control. Other clinics will just give you an injection or a nasal spray, and a lot of times they just leave you alone to experience whatever you're going to experience on the ketamine. So I've personally had ketamine. I'm a huge supporter of it, and I've heard many stories and talked to people who have had lots of success on this. Julia Stewart was our very first interview we did. She was our second episode, and she had tried everything, all these medications, all these different things, and ketamine was the only thing. After the very first infusion, it was the first time she didn't have any suicidal ideation, and that is legit. She was on our podcast. it's a real personal story that she shared, and she's not the only one that I've heard say that. So I hope you enjoy this episode. He carries so much knowledge and experience in the field of medicine, and he's just, aside from being a great physician who I believe is just full of lots of integrity and great intentions, aside from that, he's just a good dude. I love Drew. He's a great person and just fun person to be around. And when I got ketamine treatments from him, it was just great sitting in there and talking with him. He's just a good person to hang out with. After we did this podcast, we talked for like 30 minutes to an hour, just kind of catching up, and just he's just a good guy. And what I love about this is he was originally an anesthesiologist in the hospital setting and chose to leave that setting, a very secure job, to start his own ketamine clinic because he wanted to spend more time with his clients, and he felt like he was able to have a much more positive impact on their lives doing this. And I just find I just feel like his line of work is a very noble cause. I'm stoked to hear all the success stories that he's had, and the ones I mentioned that he's had negative experiences, he said, are very, very few and far between, and he's treated thousands of people, and he's just had a lot of success, and so he stands by it. Obviously, this, he said, has the highest percentage of success over anything else he's seen. And again, I'm not saying get off your medication and go do ketamine. If whatever treatment you're doing, if it's working for you, it's consistent, fantastic. If you're kind of going through all these different things, or if this is something you want to just look into, check this episode, get information. You can reach out to Drew's clinic. He's at the South Coast TMS and Ketamine Clinic in Encinitas, California, or if that's too far for you to travel, look it up in your local area. But following those, 3 things that I mentioned about a physician, IV infusion, and then being present in the room the entire time, those are like the gold standard, the obvious things you got to look for. So hope you enjoy this episode. I'll say this every episode, just share this with anyone that you think it will help. I really appreciate you taking the time to listen to our podcast. Please subscribe to our YouTube channel and give us a rating, a review if you have the time. And more than anything, just share it with someone you think it would help. That's the only way we do our marketing and our advertising, is just through you sharing it with someone else. So hopefully this is helpful, and I hope you enjoy this episode. So please welcome Dr. Drew Belnap.
In My Head is a free-form discussion podcast where we talk about issues of mental and physical health and well-being. This is not meant to be a diagnosis or treatment plan, but rather a place to share real stories and insights from professionals and people who have or are battling mental illness. We hope to create a community where people feel comfortable and happy with who they are. Hopefully this is helpful for you, and please share it with others. Thanks for listening.
3, 2, 1. All right, what's up, Drew? I'm here with Dr. Drew Belnap. He's a anesthesiologist and owner and operator of South Coast TMS and Ketamine Treatment Clinic.
Absolutely. Right? It's a pleasure to be here. Thank you. I appreciate the opportunity to chat with you.
Yeah. So when I started this podcast a few months ago, I was way surprised that probably one of the biggest questions I've got is in regards to ketamine treatments. And so knowing you, I thought you're by far the best person to have an episode with. So I'm super appreciative of your time. And it's awesome. I'm really excited for people to have access to your knowledge and information on this topic, because I know you won't say anything rude about other people, but I will tell people there's a lot of bad information out there and bad experiences you can have with ketamine. So I want to make sure our audience at least has access to top tier type of treatment if they're interested in something for ketamine, something like ketamine, or for a family member. So I'm excited. Thanks for your time.
Thank you.
Cool.
Thank you for having me.
So I just so people can get to know you a little bit, could you give us like a, 30-second to 1 minute background, like maybe your medical background? I love your stories. I mean, we could do a whole podcast on your stories of serving in the military, and so maybe just a brief background of all of that.
Yeah, thank you. Yeah, so I'm a native Southern Californian, and did my undergrad at Brigham Young University, and then went off to the military medical school out in Bethesda, Maryland, and which is called Uniformed Services Uniformed Services University of the Health Sciences. See, I even have a hard time saying it.
Even if you read it, that'd be hard.
Right. So abbreviated use. Anyways, it was a wonderful school, tri-service, Army, Navy, and Air Force. And then I did my residency training in 2005 at Walter Reed Army National Medical Center, as well as at the National Naval Medical Center in Bethesda. And it was I started rotating in the hospitals basically right when the war started with Afghanistan. And then so I basically did my training from in the hospitals with receiving wounded service members from the moment the first soldiers started fighting, and it was amazing to me to see how these dedicated service members were coming in, and we were doing our best to take care of them. And I looked forward for the opportunity to serve because I was just really patriotic, and I was also present on the grounds of the Pentagon after the 9/11 attack. And after that happened, I was looking forward to an opportunity to again serve my country, as a lot of people who joined the military did. And then after completing my training, shortly after I was deployed to Afghanistan, I was actually serving in a NATO unit with the Spanish and the Italians. I worked in a Spanish hospital. There was just a small American surgical team there, and it was a very unique experience. And we could talk about that for quite a while. But and then coming back, completed my time with the military. Total service time was 15 years with them, and then I got out and I started to work in the civilian world, and that's when I came across ketamine.
Perfect. And so that leads us right into what this podcast is about, and that's ketamine treatments, because you worked as an anesthesiologist in military and the hospital scene. So before we get into ketamine briefly, and people are going to understand by the end of this episode pretty obviously why you left that scene to start this clinic. Mm-hmm. Is there something you could say briefly about why leaving that hospital scene as an anesthesiologist? You obviously had great experiences there, mm-hmm. and fantastic. What made you leave that scene to starting a ketamine clinic?
Yeah, I going into anesthesiology, I was very pumped, very excited, and my dream specialty. And after doing it for since I started training in 2005, in 2015, I started to feel like what I was doing. I just felt kind of like a factory worker, mm-hmm. where there was this big push to get patients in to the OR and get them out, be fast, in and out, and you minimized, delays in between surgeries, which meant you just had less patient interactions. And I was missing out. Like, I just felt like I didn't have as much job satisfaction. And so I was in that kind of mode of thinking, and the call was, not so easy. And then I came across ketamine, and I was like, wow, it's really helping these people with depression and anxiety. And after I learned about ketamine, I realized this was an opportunity to kind of get that feeling of increased job satisfaction, mm-hmm. and to be able to help people in a way where I was helping them get their lives back in a phenomenal way and incredibly fast compared to how quickly standard antidepressants work, which is dismally slow. Mm-hmm. And so I just figured that this was going to be an opportunity to run my own clinic, as well as to really increase my job satisfaction and mm-hmm. really feel like I was making a difference, which has been amazing to be able to be a part of.
Right. That's great, man. I think that's awesome. And a noble transition too, to be able to spend more time with your clients. You probably get mm-hmm. to know them way better. You're spending an hour more, 2 hours, sometimes 3 hours with these patients each yep. time. And so let's educate our audience a little bit about what ketamine mm-hmm. is, because some people might think, isn't that what I receive to get put out for an operation? They've maybe heard different street names for it and not even known that this is a medication that treats mental illness. So maybe if you could educate us on what it is and how it's used for.
Absolutely.
mental illness?
So it's funny. I think most people hear about ketamine, and the average person probably only knows it from hearing about it as a drug of abuse on the street,
Right.
and or a veterinary medicine if they've heard that, and
the ketamine.
Exactly. And so, but before it was ever a street drug, it was a medication that was FDA approved in 1970 for use in the operating rooms and ERs as an anesthetic, is also a very powerful pain management medication. And then, of course, they use it in veterinary medicine. And the big reason for it is because, unlike other anesthetic drugs, ketamine actually promotes patients to breathe, despite being anesthetized. So that's very valuable in veterinary medicine. And so it's the most widely used anesthetic in the world. We don't use it in the US as much as the main anesthetic, only because we use propofol, which is a lot more expensive medication. But because ketamine is cheaper, throughout the world, it is the most widely used anesthetic medication. And so it was originally FDA approved in 1970. It went off patent in 1980. And so everybody was making it. But it was discovered in 2000 that it actually had some antidepressant properties, but pretty short-lived. And it wasn't until 2010, 2011 that they really started to do more and more studies and see if they can get it to last longer, the antidepressant effect. And sure enough, they found that if they did a series of 6 treatments, they could get it to last on average about 30 days. And some longer, some a little bit shorter, and that really just kind of opened the door for more investigation. And those studies have been replicated, and the mental health world has never been the same since.
That's awesome.
Yeah, and well, I'll just leave it at that.
Yeah. So, and what's a maybe help us know who is coming to receive these ketamine treatments? What range of mental illness symptoms are people coming for? And maybe what are they not? Because there are certain ailments that people shouldn't receive ketamine treatments.
Sure.
And so maybe help us understand that.
Absolutely. So there's the FDA approved use is for anesthesia, for pain, and to be used in a hospital setting. But since it was discovered that its strong antidepressant effect, people, like the conditions that we treat at our clinic are depression, anxiety, OCD, PTSD, and suicidality associated with depression and anxiety. And then, of course, we also treat chronic neuropathic pain, which is basically a nerve type pain. It's very unique, but it works very well for it. And so those are the main uses for it. There's some other obscure things that people are trying to treat it for, but those are the main things that we treat patients for at our clinic.
Okay. And anything people are not coming for? Like, are there certain... did you say schizophrenia is, and are things usually people shouldn't be using ketamine for? Or
yeah, so for psychiatric means the patients who wouldn't be good candidates for treatment would be schizophrenics and people with psychotic depression, because with ketamine you're basically kind of inducing this state which is a dreamlike state, and schizophrenic patients or psychotic patients, it's going to be difficult for them to understand what's real, what's not real.
Yeah.
And that would not be good.
Yeah.
So we don't treat those patients. But the other patients I mentioned, depression, anxiety, that's our average patient.
Mm-hmm. Okay. Awesome. And so if you could explain, this was something that was so intriguing to me, is how this is actually helping depression, anxiety, because you have like SSRIs, like selective serotonin reuptake inhibitors, and that's actually a process of working with your receptors to allow more serotonin to build up. So that has a very specific mechanism. Is there a mechanism to ketamine? And I know that they're still studying it and still trying to figure it out. But the cool thing that I remember learning about it was, and we'll talk about this in a little bit, but you talked about this dreamlike state or often referred to as like dissociation.
Mm-hmm.
Your brain actually is making, I'll let you explain this, but you told me how it's making certain connections that have either been broken or it's almost doing some type of repair process that's going on. So it's not only detaching you from a negative state, but it's also doing some type of repairing process.
Absolutely.
As well.
So we could talk for another hour about like the proposed mechanisms of ketamine. It's a area of fascinating discussion. But to sum it up, you have to kind of understand how people got into experiencing depression and anxiety in the first place. And a lot of times depression and anxiety is triggered by chronic stress. And then usually that's accompanied by a lack of sleep, and the brain isn't able to have adequate time to have restorative sleep and give the brain a break, essentially. And as that stress builds up on the brain, or there's in the case of PTSD, there's a main traumatic event. What happens? One of the things that happens, I should say, is that in the brain, there's your neurons, which are your nerve cells, and they talk to each other through what's called dendrites, and they are essentially the wires connecting the neurons so that they can talk and communicate. Well, those dendrites, they have been shown to atrophy, to waste away from patients who are experiencing chronic stress. And when that happens in the mood center of the brain, that's what leads to depression and even anxiety. And what ketamine does, that's pretty universally accepted, is that ketamine causes the release of what's called brain-derived neurotrophic factor, which is BDNF, as we abbreviate it. Ketamine triggers the release of that compound, which then promotes the growth of those dendrites. So ketamine is essentially reversing the damage done from chronic stress, which led to depression and anxiety, which was the atrophy and the wasting away of those dendrites. It promotes the growth of those dendrites. So new dendrites are growing and reestablishing those connections between the neurons, the nerve cells in the brain. And basically the brain starts working the way it was designed to. So patients who can remember not having depression and anxiety, they'll tell me that, wow, I feel like I did when I was 20, and it's not like, oh, they're a different person. It's they feel like their old selves, and they don't feel like they have that burden of the anxiety and depression hanging heavy on them anymore and holding them down and keeping them back from being their best self. And another way that ketamine works is, you mentioned SSRIs. The majority of antidepressants work on what's called the monoamine system, which is your norepinephrine, your dopamine, your serotonin. Well, it's only estimated that anywhere from 15 to 20% of our brains actually use those neurotransmitters in their brain, whereas ketamine works on the glutamatergic system or glutamate. And it's estimated that 60% of our brain uses the glutamine neurotransmitter in our brains. And so that may give us some clue as to why it seems to work more quickly, because the dendrite effect, that takes about 12 to 24 hours to really work after a ketamine infusion. But we start to notice some patients having results as early as 4 hours after the first infusion. So the dendrite, explanation doesn't completely explain why patients are having this quick turnaround. And so there's some thoughts that it has to do something with the glutamatergic system. And then also depression is an inflammatory state in the brain. And ketamine has been shown to have some anti-inflammatory properties. So the anti-inflammatory, the glutamatergic system, and then the regrowth of dendrites through the release of BDNF are some of the leading theories as to how ketamine is working and working so fast and so effectively.
That's awesome, man.
Yeah.
I appreciate you going into all that, because that's it's much more than just there's so much going on there. It seems like it's not just masking a problem, but it's allowing actual recovery. And the thing that blew me away, and full disclosure, I've received ketamine treatments from you in the past. About a year ago, I received them, and we may get into that more. I'm happy to talk about my experience because it was a very positive one. But our second episode on this podcast, back in February, I think, with Julia Stewart, and she's totally fine with us sharing this. Obviously, she did our podcast, but the thing that blew my mind about her was she said she tried everything, and she was like, the thing that really impressed me about her, and she said it right on the podcast, was, and I don't want to give false ideas, because this isn't the case with every single person, but with her, she said after her first treatment, she didn't have any suicidal ideation, which was, I mean, nothing short of a miracle, especially for her, where she was at. And so that's what blew me away. And I remember when I did treatments with you, and we'll get into the actual process, but I remember you fill out a survey of how you're doing, like very detailed questionnaire. And I remember coming back after 2 or 3 treatments and you being like, how do you feel? Like, and I'm like, I think I feel good. Like I feel okay, And then I filled out the same survey, and it was almost like half of the level of depression, anxiety I'd originally came in for. And that's what was great. It wasn't this like, it's nothing so radical where it feels overwhelming or anything, that I was like, whoa, like I was just answering it honestly. I didn't remember what I put before on each answer. And so it's pretty cool. So I obviously back it. That's why I wanted you on this podcast. And so the important thing here that I want people, I would love for you to explain, is because you obviously do this in Encinitas, which is North County, San Diego, California. Maybe somebody listening to this lives in New York and they can't, or Florida, and they can't make it here to get treatments from you. What things should people look for in their area? What are the key factors people should be looking for if they're interested in getting ketamine information or receiving ketamine treatments? Can they just Google ketamine in my area and they just go to the first place they find? So people should understand that different ketamine clinics do it very different way. Right. So what would you say is the difference between what you do and what other people do?
That's a great question. So, using my clinic as a model.
Let's do it. Let's do some promotion here.
So, there's a bunch of clinics out there, and there's a lot of people who are trying to get in on ketamine success. And number one, it should be a physician. And it should be a physician who not only knows what ketamine is as an anesthetic, but how to use it as an anesthetic medication. And then if there's any issues with it as an anesthetic medication, that provider should be able to address them. And that's what, if you open up every, ketamine comes in a box of 10 vials, and there's a package insert in there, and it explains who should be administering ketamine. And in that insert, it says that ketamine should only be administered by a physician who is trained and who's proficient at providing airway management, and who can support the airway if needed. And that basically limits it to a small group of physicians who can monitor the patients, monitor their vital signs, and understand what those vital signs mean. There's a lot of physicians who understand what vital signs are, but as anesthesiologists, we monitor the vital signs continuously. And we're doing that in the operating room, and we're also doing it with ketamine. But not every physician receives that training on how to monitor someone continuously. And they don't know how to interpret EKG rhythms. and they don't know how to pick up on the subtleties of the oxygen saturation. And that's all our bread and butter as anesthesiologists. That's our training.
That's your training.
And so when we're providing the ketamine infusion to our patients, we're continuously monitoring just like we would in the operating room. And we understand what's going on. If you have a provider who's not even in the room and the monitor is in there, but if nobody's looking at the monitor, that's, to me, I would be hesitant to go to a provider who's doing that. If somebody's watching watching the monitor from, remotely, that's okay, as long as they're actually watching it.
Right.
And as long as the patient has a means to communicate with somebody and say, hey, look, I need you in here. And they're able to respond quickly. And the physician should be on site so that they can respond as well if there's any issues. Me personally, I'm in the room with each patient. And part of the reason I'm in the room is because I feel like in order for ketamine to be effective, it needs to be comfortable. And if it is not a comfortable experience, patients aren't going to want to do it. They're going to be like, it's not worth it, you know, and ketamine can get uncomfortable.
Right.
And so if the dose is too high, and what we're finding is everybody has their unique sensitivity to ketamine. Everybody has a dose that works best for them. And if you just start someone out with the research dose, that may be way too much for some patients. And you start them out at that dose and they feel like they're like, where am I? I don't understand what's going on. And it's too much. And so at our clinic, I'm in the room and I go up gently on the first infusion. And I slowly go up on the dose as the patient is still continually comfortable. And then I just keep going. And as they continue to stay comfortable, I make adjustments throughout the infusion until I start to see that they experience some of the symptoms that we're looking for that you typically get with ketamine. And so it's a much more gentler approach. And that's truly what patients, that's how the first infusion should be. And then subsequent infusions, basically, yes, you can pick a dose and go with it because kind of how they're tolerating ketamine. Some people tolerate it really well, and some people are really sensitive to it. And even a small amount, they're like, whoa,
And so I don't mean to cut you off, but what is fantastic about you being an anesthesiologist is the level of control during the infusion. Because and it's case by case. You might have someone comes in and they tolerate it perfectly. And I remember my first visit saying like, yeah, I usually tolerate like any medication I've had with surgeries and pain. I feel like I kind of have a high tolerance. And, and we started and I was like, oh, all right. And you're like, yeah, it affects everybody differently. I wasn't like on the moon or way out there, but you were just like, yeah, there's no consistency to who it affects, how. It's just, that's why you're there. So I'll be honest, the only negative experiences I've heard with people who have received ketamine are the ones who have received it differently than what you just described. So the key components to what you just said is a physician who's trained in these aspects of monitoring the patient's EKGs, right? O2 levels, all these things, so physician trained, present in the room with them, IV infusion, and comfortable. I mean, these are like they should be no-brainer components to receiving ketamine. In my opinion, I know that's your professional opinion as well. The people I've heard that have had negative experiences, one woman, the story I heard was she went in, she just received a injection in the arm, and the physician, I don't know if I'm assuming it was a physician, left her for 45 minutes alone. She said it was the most terrifying experience of her life. There's no control, there's no physician present. You're just left there to experience whatever happens. And for someone who hasn't received it, they might not understand why that can be scary. But the control of an IV fusion, and you're able, I mean, don't mistake when you're on ketamine that you're just like out cold. Like you can talk the entire time, right. You can speak to you. And so the one thing I wanted to add, which you've already said great, is you're not just receiving ketamine, but for me, it was almost like you being present is also an added layer of therapy as well. Because I was like chatty, like I would be like, yeah, just talk the whole time, like,
right.
you know, you have like videos playing of nature and music of your choice, and I remember one, you were just like, I was like, yeah, just read about, we were watching one that was like space, and I was like, yeah, you said we were looking at like facts about space and sun.
Right.
And it was weird how that is like therapeutic for me, just to be grounded and have you in the room and talking. So is there anything you want to add to that experience? Because I think it's just important that people know those key aspects of it. And I know that not everyone experiences it the same, but the people I've heard that have had that type of ketamine transfusion or
it's infusion.
Transfusion. Take it from someone else. Like, yeah, an infusion is when they've had it with those key components, they've had a good experience with it. So
yeah, it's easier to understand what not to do, right? Like you said, and you know, there's a bunch of clinics out there who are in it to just make a lot of money. And so they're trying to get patients in and out as quickly as they can. And you got to beware of those clinics, because they basically, you know, spend a short amount of time with you. They get you in there, and then they get you prepped, get the IV started. And then, you know, they give you a button to hit if you need something. And then they walk out, and you're all alone, and you've never experienced ketamine, or some people have never felt altered in their entire lives, and they just leave you alone and say, all right, and, you know, enjoy your journey, you know, and luck. Yeah. And then they just put on some music for them, and whatever it is, classical or, you know, whatever music they have, you know, and then some patients are sitting there just sitting there waiting, staring at the wall, or, you know, trying to think good thoughts and stuff. And it's really hard. And I've had patients come and tell me after experiencing this at these other clinics that it was just miserable. And that there was nothing there to ground them. They didn't have anybody there that if they were experiencing something that they could say, hey, is this normal? Because they're not there. And they felt like they didn't want to bother him by hitting the button and bringing him back in there. And eventually, when the ketamine really builds up, and if they're really sensitive to it and it's really strong, sometimes the button can be in their hand, and they'll just forget that the button's there, and they just feel kind of trapped.
Yeah.
And they're just like, oh, you know, how do I get out of this? And they forget that they can hit that button to bring people in, and they just kind of try and get through the experience until the ketamine is done, and they're hoping for it to wear off. And then like after that, they're like, no, I'm not doing ketamine again. That was miserable. And so, and then they just say, yeah, no, ketamine is not for me. But in reality, when you do it the way I just described earlier, where you start low, you start at a really low dose, and you find, because you're going to find the patients that are really tolerant to it, they're not going to feel anything. You're going to be like, has it started yet? But the people that are really sensitive, they're going to be like, oh yeah, I'm starting to feel this or that. And then you slowly go up. And then when you're in the room, as they're starting to experience things, they can start telling you what they're feeling. Like, yep, that's normal. And you're a reassurance to them, like, yeah, that's normal. And that's to be expected. And they feel calmer. They feel more at ease with somebody who's in the room, who's seen thousands of infusions, and they're like, okay, yeah, this is cool. And they feel safer, because they know that if anything happens, that person is the most qualified to take care of them in case something happens. And so they just feel really safe. They feel very comfortable. We create an environment where they're in a soft power recliner chair, where they're watching these high def nature videos, and those videos are key. But you can't do the videos if you're leaving them alone in the room. It's very hard to. Some people try, but it's very hard to, because sometimes when the ketamine is building up, when the patient thought they liked the video, towards the end of the infusion, they'd be like, no, I don't want this video anymore. And you can respond quicker if you're in the room already, and you just change the video really fast, and you know the videos, and you can change them quickly. And you want to be able to do that, because you want to keep the infusion comfortable. And with ketamine, whatever it is that you are experiencing, ketamine is going to enhance that. So if you're feeling positive, you're looking at nature and you feel very awe-inspired, or like you said, if you're talking about whatever that your interests are, and you're having a good discussion, you're going to feel really good about that.
Right.
And I've had wonderful discussions with my patients who want to talk during the infusion. And some of them want to talk during the infusion because they still feel grounded, and they still feel kind of present when they're talking to me, even though they're feeling the effects of the ketamine. And we talk about whatever they feel comfortable talking, sports, movies, whatever. And then other patients that prefer not to talk, and they watch the videos and enjoy it. And there's a whole spectrum in between. But the beauty is when the provider's in the room, they are there, like myself, to check in on them. And I ask them periodically, are you comfortable? And, if they're not, they'll say no. And then sometimes it's the video. Sometimes you change the video and they're like, yeah, this is good. Sometimes it's the music. Sometimes it is the ketamine. And then you have to either stop the infusion or just slow it down, depending on how uncomfortable it is. But usually if it gets a little bit uncomfortable, you stop, and within 5 minutes, they're feeling good again. And you can restart the infusion and go the rest of the infusion and do just fine. So the key with ketamine and the key with success is you have to be comfortable. And if you're comfortable with it, you're most likely going to complete all 6 treatments. And that's where you have the most success. You can't have the attitude, I'm going to come in and just do 1 or 2 treatments and see if I get a result, because everybody has a dose that works well for them. And if we can't get to your dose until the 4th treatment, you're not even going to know if it's going to work for you.
Right.
And so I tell my patients, when you're coming in, commit to the 6, because that's where you're going to have the most success. Don't think you're going to be able to do 3 and then know for sure with ketamine is going to help you. So I've had some patients who got, I classify people as like kind of early responders, who even after the first infusion, within 4 hours, they start to notice benefits. And then I have kind of mid responders, people in the 3rd or 4th treatment, they start to respond well. And then people at the 5th or 6th treatment start to respond well. And part of that has to do with trying to get to that dose that works best for them. And you have to have an experienced provider who knows how to go up on the dose and not overshoot. And because everybody has a ceiling. Everybody has a ceiling. Where you get to that ceiling, it's going to start to get confusing or uncomfortable. And if you get to that level, they're not going to want to continue ketamine because they're like, I don't want to go back there.
Right.
That was miserable. And so it's not you can't do a cookie cutter approach to ketamine. And that's what a lot of these other ketamine clinics are doing. They're just putting them in a room. Here you go. Here's your ketamine, and hit this button if you need us. And and a lot of those people are having miserable experiences, and then they're posting their experiences online, and people think that's what ketamine is about.
Right.
It's not. And if you come to a clinic like mine, I can't guarantee 100% that your experience is going to be positive, especially if we're pushing the envelope and trying to get you to a higher dose, that it's going to be 100% positive.
Yeah.
But it's going to be as positive and comfortable as I can possibly make it. And for the majority of my patients, it's awesome. The majority of my patients love the infusion. They enjoy it. It's very comfortable. And that's the way it should be, because when the infusion is comfortable, it feels therapeutic even in of itself to have that break from the depression and the anxiety or the PTSD symptoms or the OCD, the obsessions or the suicidality. That experience is a break from all of that. My patients describe it as a vacation, like a real vacation, from those symptoms. And it's just a wonderful experience. I've even had one patient offer $1,000 to keep going, because he enjoyed it so much. And I said, sorry, man, we have patients after you.
Right.
But like,
well, and people might hear some of this who are very unfamiliar with it and imagine just this, like, it's like, oh, so they're just like getting high, but I mean, people who are unfamiliar with it might just take that route, and it's so not that. It might seem like it because we're talking about dissociation and almost dreamlike state, but it's almost, I mean, I wouldn't say it's something you have to experience, but I would say it's no different than you're taking medication and this is almost changing a process that's happening in your body over a long period of time, where ketamine is doing that. What we're seeing is it's happening much quicker, and it seems to be doing it at a, I don't know if I would say deeper level, but it seems like it. It seems like it's taking a different approach, and I've talked to you for a long time. In fact, I might, in the podcast, I might link to the video we did where Julia Stewart's in that video, and we did the video for your business. But you've literally had people say that you saved their lives. Like this was for them. For a lot of people, ketamine's like a last ditch effort. Like, I've tried everything. I don't know what to do. And unfortunately, maybe they come to this last. And I know that's how it was for Julia. And she was just like, it was the last thing I found, and I researched and I tried, and it was, lucky for her, that was the thing that has helped her. So I know, I mean, you've told me that people have literally told you it saved their life. And so that's gotta be awesome. I mean, obviously for them, it was the only thing that has helped them. And so I've done some rewarding things in my career, but nothing as consistently rewarding as running this clinic and seeing time and time again patients being like, wow, I never even thought this was possible. Yeah. And just people, even after one infusion, I had one patient telling me, like, I don't understand how I don't feel suicidal right now. I don't get this. This is beyond me, awesome. And other patients who just come in just elated, and their family members are elated, and they're like, wow, I get my son back, or wow, I get my daughter back. And, it's just remarkable. And I love doing it. And that's why there's a huge pressure to open up like multiple rooms and get more patients and get going that way and do those things that the other guys are doing to make a lot of money. But I enjoy getting to know my patients. I enjoy spending that time with them. I enjoy seeing the improvements and getting to know them, becoming, part of their recovery. And I invest, myself in their recovery. And it's a wonderful thing to witness and to be a part of. And it's hard for me, though, when I hear things and read things out there on the internet where they badmouth ketamine, because 9 times out of 10, they were getting it from the wrong provider, or they were doing it in an ineffective way. And talking about ineffective ways, the IV infusion, you kind of mentioned this earlier, the IV infusion is the gold standard. And that's all we do here is the IV infusion. Right. That's where the majority of the literature is, that's what's being studied, is the IV infusion. And there's specific reasons for that. They're finding that the consistent delivery of ketamine for a prolonged period of time contributes to the antidepressant effect. And so these other people who were doing the nasal spray or the eye intramuscular injection, they're not seeing the same results, and nor do they have the research backing them up. You have S-ketamine, which is, the nasal spray of ketamine. I kind of describe that as, sure, it's great if you can't afford the regular IV infusion, but its effectiveness is at about 40%. You contrast that to my clinic and how much success I'm having, where 86% of my patients are having at least 50% improvement of their symptoms of anxiety and depression after completing the 6 treatments, and 40% of those patients are actually going into remission. It's just phenomenal. My remission rate is equal to their response rate for the nasal spray, right. And so it's just not a good delivery. And the physicians who are doing it and doing the shot, especially, they're not being honest with their patients. They're not telling them that there's a lack of literature supporting that delivery. When you're giving a medication, it's not just, hey, you're getting the medication. It's how you receive the medication. And so that matters. And when you give it a shot, depending on how much blood is in the area that's circulating, you can get a really large rush of ketamine or a much slower thing of ketamine. So there's a huge variance in how much you're getting.
And then with the shot, you just get this quick spike and then it comes down, and it's not with the infusion, you get a nice, steady, consistent delivery of the ketamine, until it comes down. At our clinic, we do it over 50 minutes. Other clinics do 40.
When I remember getting my treatment and finding that perfect spot you were talking about, and I remember you continuously talk and ask questions like, how are you feeling? Are you feeling okay? And I remember I literally was just like, I got to a point where I was like, it feels a little intense. And you were like, okay, you have full control over backing it off a little bit.
Yeah.
I don't know, 2 minutes, maybe 2 to 5 minutes. I was like, all right. And I was right back to it. And we found that spot, and it's insane the amount of like control that's there in the room.
Yes.
And to me, it's a no-brainer to go that route, especially if you've never experienced ketamine. Just for the level of control that is in there, especially you're not sure what you're about to experience. And I fully understand why people who do it the other routes, who get scared and are like, do not mess with ketamine. And I'd probably say the same thing if I had that experience.
It's in the Time magazine article, they quoted a patient who was doing the shot, and she says, yeah, it's a miserable experience, but it's the only thing that's helping my depression. And that's so not necessary.
Yeah.
If you do the IV infusion, it can be comfortable. And it should be comfortable. And a lot of the times it's more effective too. The shot, you don't get the same results. You don't get as prolonged a result, and it's not as effective. And the providers, the physicians who are saying that it's the same, they're not being honest. And you ask them, where's your literature? And they'll just be like, there's just not much. There isn't to support it. They just say, oh, it's ketamine. And no, delivery matters.
Yeah.
So, same thing. When you get that huge spike, there's no taking it back. They give the shot, it's given. You have to write it out. Yeah, whereas the infusion, if it ever gets even slightly confusing, we're like, is it? Okay, well, let's decrease it. Boom, and it's comfortable.
Yeah.
But with the shot, hold on,
buckle up.
and nausea is a rare side effect, but if it occurs, like, how you can treat, you can give a shot, another shot of something, but it's not as effective. And if anything else happens, you don't have an IV to treat those things that could potentially happen. Ketamine's a very safe medication. It's rare that other things happen. However, IVs is the safest route to go. It's the most comfortable way to go, and it's the most effective way to go. And anybody who says anything else is not being honest.
Yeah. That's great information. So for you mentioned 6 treatments. So you do 6 treatments over the course of 2 weeks, right?
Yep.
And then you have what's called booster treatments. So maybe explain those. So you recommend, obviously you've said this very clearly, if you're doing it this way, like the way you're administering it, definitely the 6 treatments over the course of 2 weeks. And it's usually like a Monday, Wednesday, Friday, right? I think that's what we did with me. Like every other day for 2 weeks or so. Every
Correct.
2 to 3 days.
So I've kind of evolved on that too a little bit as well. So
upgraded now.
So that's what the research was. The research was Monday, Wednesday, Friday for 2 weeks. I still do that if patients request it. But the problem with that approach is that I was running into is that you really only had like a day and a half to kind of figure out how they were responding. And it was very common for the patients to come in. So you did Monday treatment. It's very common for them to come in on Wednesday, and they're like, it hasn't been that long. And the peak effect is at 24 hours. So really you just have like half a day to kind of figure out how it's really helping you. And why that matters is because if you've gotten a significant response, then I'm like, okay, we don't need to make a big dose adjustment for you today. But if you're getting a minimal response, then I may make a more significant change in the dose. Or if you got a good response, but it's not great, but we're going the right direction. It just all depends on that, and I will use that information to determine what dose adjustment I'm going to make. And so I find it to be more useful to have at least 2 days between treatments, to give the patients more time to figure out how it's affecting them. And I find it's just as effective as the 2 weeks, if not more effective, because I'm able to do better dose adjustments. Now, again, if patients want to do the Monday, Wednesday, Friday, I'm on board.
Yeah.
I'll do it. And just realizing that it's a little bit harder for me to determine the dose adjustments and stuff, but we get it done. And sometimes, you can even do, if you had to, you could do 5 infusions in a row. And I've had patients do that, they're coming in from out of town to receive the treatments, I've done that and we've had success doing that, but it is more challenging for me.
Oh yeah.
And a little bit more challenging for the patient because they don't really get a break,
Well, and I hope people listening and watching this can pick up on your, integrity in this whole process, because how easy it would be to be like, yeah, this is our process. 5 days in a row, we'll get you in and out. Like, we're known as the fastest clinic around,
Right.
Or 2 a day, like come in the morning and night. I mean, you could easily do that and make more money. You could see more people. And the fact that you've seen like, oh, this works better. Actually, let's give it 2 days in between. I'm so grateful doctors and medicine and all this is out there, but I don't want to generalize, but I feel like that's pretty rare to hear something like that. Like, here's what we could do is we could make a little less money, but it'll help people. You know what I mean?
Right. Right.
Obviously more people are going to hear about it. You're going to get more clients and your business is going to, as more people hear about this, you're going to get more, I hope you do. You're going to get more people hearing about it. But the fact that you are doing an ongoing process of adjusting this instead of being like, wow, you know what? We've got 3 rooms here. Let's pack all 3 of them at once. Let's do injections in an hour. Like, you better be out of here in an hour and get more people in. I mean, it's an easy way to get people in, but I hope people see that through in this podcast, that these are true, like, pure intentions of you seeing results and you're adjusting it so people are receiving the treatment they need. And that's what I've always respected about you, and I'm really pumped about. So,
well, thank you.
Appreciate you taking that approach, and it's really just refreshing to know there's people out there doing it with these intentions, and I think it's awesome. So,
thank you. I appreciate that.
And so, maybe just real quick, explain. We just mentioned booster treatments. So, is that after the 6 treatments? Do you feel many people 6 weeks down the road need one of these, just one more at a time, or how does that work?
Well, before you get to the booster treatment, really is where you leave off after the 6th treatment, that's where you're going to maintain. So say your potential with ketamine was to receive 80% improvement, and we, after the 6th treatment, got you to 60%. Well, when we go as needed and we go with the booster treatments, we're going to be maintaining you at 60%, not the 80%. Mm-hmm. And so with the initial set of treatments, you really want to maximize your benefits. And so I've had patients who are early responders after 4 treatments, even 5, they're like, I don't feel like I'm getting much better. But you look at their rating scales and they have very minimal symptoms of depression. Right. So at that point, you literally could go as needed at that point. You wouldn't need the 6th infusion. You would just say, hey, let's go, let's start, see how long you go before you need a booster treatment, which is on average is about 4 or 6 weeks before you need a single booster treatment. And well,
that's what's so helpful with that documentation, is because seeing that with your own eyes, you're like, whoa, I am better. And I'm almost used to being better. Yeah. So I'm like, I'm just all good, and I've noticed that even with my own experience with anxiety and depression, is documentation, whether it's in a journal or something, documenting how you feel. So when you start to feel a little anxiety, you can go back and be like, wow, it's actually not near as bad as it was. But that's what was cool. I think it was cool about your process, was seeing those numbers and be like, whoa, I'm doing pretty good.
Yes. Yeah. And there's a phenomenon that occurs, and that's where people come in to me in pretty bad shape, and they're very depressed, very anxious, and they fill out their scores and they get better on the ketamine. And it's funny how quickly they become, that's their new normal, essentially. And how quickly they forget where they came from. And it's funny because say 4 or 6 weeks later, it will slowly, the benefits from the ketamine will slowly start to wean. And so that's when typically we love to have patients come in and get it before it continues to go down. And it's funny when they come down, some patients will come in and they'll tell me like, oh my gosh, the depression is horrible right now. And then they'll fill out their rating scales, and then I'll look at them, and they're not even 50% worse than when they came in. And they're like, and I show them, where they were at before they even started treatment. They're like, oh yeah, okay, now I remember that. That's true. But they just got used to living life at their new level. And so as it starts to drip, they start to, they're like, oh, I don't like this.
Yeah.
And so, and it's important to know, why does it start to dip, right? Like why do patients need a booster treatment? Well, it goes back into the whole BDNF and the dendrite, mechanism, essentially the growth of those new dendrites that are regrown, they're still sensitive to stress. And so if the patient isn't doing enough to mitigate that stress by going to psychotherapy, continuing their medication, or, eating right, getting good sleep, all those things they know they need to be doing, and they're just allowing the stress to hit their mind, it's, that will determine the length before they need a booster treatment.
Right.
It's what the brain is still exposed to as far as stress wise. If they do all those things, proper exercise, psychotherapy, good diet, good sleep, they're doing all those things, they'll find that they'll be in that 6-week category, 8-week category before they need another booster treatment. And eventually they won't need any more ketamine. And so I preach that to all of my patients, especially psychotherapy, especially with anxiety. That's where patients get the most benefit, is when they combine psychotherapy with ketamine. And of course, proper sleep as well. So ketamine is not a one-size-fits-all approach. And I preach that to all my patients. They need to do all the other stuff if they really want to see the most benefit.
Yeah.
And extend those benefits longer, so they don't need a booster treatment as sooner. But even if somebody comes in and they're at, they need a booster treatment at 4 weeks, it doesn't mean they're always going to be at 4 weeks. As they continue to work on those other things, they'll see that it lengthens out. And also, just the nature of depression in general can be episodic. And so, or life circumstances change. They get a new job, or their relationship issues change, and they're in a better relationship or something. At those points, sometimes they feel that they don't need the ketamine anymore. Yeah, I get asked that a lot. Like, how long do I have to be on ketamine,
I think you explained it really well. I mean, because those are all obviously questions everyone's going to have. Is this just going to be a lifelong theme for me? I think it's so important, too, that you talk about the other. I mean, this should supplement a lot of the healthy things you're already doing. It's not the one-stop shop. Brad, all I got to do is go see Dr. Drew, and I'm good to go. And, and it's obviously going to be a huge baseline for their recovery, but therapy, healthy eating, obviously sleep, all these things are supposed to be supplemented.
They're
with
vital.
This. Yeah. So I think that's huge. And I appreciate you explaining all that. And so many other things we're going to talk about. I think you already covered so much. I wanted you to paint a picture of what people can expect when they come to your clinic, or what they should look for in other clinics. Like, I mean, power recliner chair, watching nature videos, you present in the room. All these things are so important to the whole experience of being comfortable. That's just going to help in the therapeutic process. If people are worried about needle pricks, I mean, no one better than a certified anesthesiologist to do this.
Absolutely.
Needles they've never been a problem for me, but I've talking with you, doing that video we did with you. I mean, you get all different types of people that come in that are nervous about needles, or don't have big old protruding veins I do in their arms. And so, but I mean, there's no one better than a certified anesthesiologist to do all those types of things. So I'm more just saying it for people to understand what to look for if they're not able to come to your clinic. These are all huge things to look for. I feel like you already talked about this, but I think if people are still maybe a little concerned with this whole talk about dissociation or dreamlike state. Could you say a little bit on that and I'm happy to talk about anything as well, but what that is, and just clarifying that you have full control over body, thoughts, you can speak, you're not in a state of paralysis.
Right.
I think you even provide like a blanket for your
Right.
blanket for clients if they want. So you're super cozy and you're coherent. So I mean, maybe dispose of any I don't know, misnomers or misideas of what this whole dissociation process looks like.
Right. So you first mentioned like how to pick the right clinic, and I think that some of the key factors are when you read these websites of these physicians who are running them. I have known physicians who've asked me how to do it, and I was just too busy to help them. And then lo and behold, a month later, I see they're advertising it like they're an expert. And they didn't have a clue what they were doing, but yet they're acting like they're an expert. So you want to ask, how many have they personally supervised? There's other clinics who say, "Oh, I've done thousands of infusions." Well, a lot of times those are the ketamine mills, and that's the physician is there, but not really there with each patient, and they're claiming all those patients, and they're claiming, "Oh, I've treated 500, 600 patients," but in reality, they don't even really know them that well at all. And so, so again, you want that personal touch. You want someone who's who's there and who's personally supervised thousands of infusions, not just been in the clinic. And then also, you want all those things that you mentioned, the power recliner chair, being comfortable during the infusion is key. Most of these other clinics, they have these hard recovery chairs that are uncomfortable, especially
sitting in a school desk or something.
Yeah, exactly. and you're in a cold, like, clinic room. It's
meat locker.
Yeah, exactly. With our clinic, we try and mimic a home type environment.
Yeah. And
that's why we have the recliner, we have the furniture in there, another leather recliner chair that your guests can also sit in and recline and relax. And so it's basically, you want to feel comfortable, number one. And then two, the experience is key too, right? As an anesthesiologist, you hit the nail on the head. So many patients are worried about that IV. So many patients come to me. I'm like, I'm not a fan of needles, but they're desperate to get relief from their depression, so they're willing to come do it. But I can't tell you how many times, just because I've done thousands and thousands and thousands of IVs, I've done the IV on patients, and they're like, "Wait, it's done? I didn't even feel that," or at most they're like, "Oh, I felt a little tiny prick, and that was amazing," and that's just because experience matters. I've had, nightmare stories where patients have come to me simply because the other clinic could not get an IV in them.
Oh, man.
And they were just torturing them, trying to get the IV. And I come and I just do the IV, and they're like, "Oh man, that's the way it should be."
Right.
And so, the IV should not be torture. The IV should just be a minor, speed bump. And even if that, I have never not been able to get an IV in a patient ever. And I've done over 2,000 infusions, and I've had really difficult patients who tell me.
You talked about having like even the needles used for babies, right? Like
Yes. Yeah, exactly.
If need be, or.
Well, I use that in every patient.
Oh, okay.
I use the smallest needle that is manufactured, and that's the one that they use in babies. Mm-hmm. So, and I've had patients who've told me, "Oh, only the best of the best in the hospital can get me," and they're using ultrasound and all those other techniques, and
like, "Wait, you're done?"
Yeah, and I get it done. They're like, "What?" Yeah. And so it's just, I have a lot of experience doing it. So anyways, so there's that, and then also you want someone who's doing the rating scales. I can't tell you how patients have come to me from other clinics, and I'm like, "So how are you doing your rating scales?" They're like, "Rating what?" Like, they don't know what that is. And if you're not doing rating scales, how are you going to track your progress? So I have a depression scale that I have my patients fill out when they first come here. That's the baseline. And then an anxiety scale. And if they have PTSD, I have a PTSD scale for them to fill out. If they're coming in here for chronic pain, I have that as well. And we track their progress, and we have them fill it out every other visit approximately, depending on the length of time between treatments. And so they can track their own progress, and I can track their own progress, and they can see for themselves, like, oh yeah, this is rated by me. This wasn't Dr. Belnap and his assessment of me. This is my own assessment. Right. And so that's more convincing to them that, oh yeah, this is definitely working. And so you definitely want someone to do that, because it helps you understand your own progress that you're making with ketamine, especially because you can have that reset where, right, it becomes your new normal, and you're like, yeah, I don't know, I feel like I always felt like this. And you're like, no, look at your original, right, thing. And you're like, oh, that's how I used to feel. That's right. Yeah. But, so there's that. So you definitely want all those things I mentioned. And that's obviously, that's our standard process here at our clinic. Yeah.
So then the second part to that question is like the dissociation. How would we describe that? And what misunderstandings could we dispel with for people, so they don't think they're just coming in for 2 hours and
right,
going on, bouncing on rainbows and then leaving.
Right.
Which maybe it feels that way. I don't know.
Right. So what is ketamine not? So ketamine is, a lot of people are like, oh, it's a party drug. It's a date rape drug. That's how a lot of people kind of hear of it. And even though it's mainly used in hospitals, it's, right, but as far as what other people are aware of it, it's kind of scary to them, and because they just don't know much about it. And but in reality, when ketamine is given in a controlled environment, it's very comfortable. And the things that you were just mentioning are very comfortable for patients, even patients who've never experienced anything like that. They love it. And but they're not going to experience hallucinations. Not one of my patients has seen something that wasn't there, given the doses that we're giving. Because in reality, we're giving sub-anesthetic doses of ketamine. We're not giving the dose that I would give a patient to go off to sleep. Mm-hmm. Not even close to that. We're giving far less levels of ketamine, and we're giving it over 50 minutes, whereas when I would give a patient to have them go off to sleep with ketamine, I just give them, I push the whole syringe and they go off to sleep. But so we're giving it over a prolonged period of time, and what they feel is mostly visual, perceptual changes. And like they'll see color changes. They become more sensitive to light. They become more sensitive to sound. And that's why we play relaxing music, so that kind of stays comfortable for them. And then as far as dissociation, so dissociation is a hard term for some patients to understand, but most people understand, like when you're driving down the road and, like 30 seconds or a minute later, sometimes you're like, oh my gosh, how did I get here? Mm-hmm. And a big part of that is because your mind was thinking something else, but your body was still sitting there and following the car in front of you and doing what it needed to do. And so your mind was essentially dissociated from your body. Right. And that's essentially what ketamine is. I mean, it's very much like a dreamlike state. It's very much like you're dreaming, but yet it's, you can still respond the way you would normally talk. I've had multiple patients come in with friends and like getting out their phone and like, this is going to be hilarious, goofy, yeah, and they're going to say something stupid and they don't. And they're let down. And
it's not like driving home after you got your wisdom teeth out and the phone's out. It's on YouTube. It's really it's kind of anticlimactic for viewers.
It is. It's anticlimactic for the friends or the family member in the room. They're like, oh, that was boring, Yeah. And the person who's actually kind of smiling and like, oh, this is cool, is the patient. Yeah. They find it the most interesting. And but they don't really say anything funny. They're not going to say anything they wouldn't normally say. Right. They're still in control of all of their faculties, essentially. Mm-hmm. And we're using really low doses. So the first thing they start to feel is like kind of relaxation. And then after that, they start to feel, especially the way I do it at our clinic, where it's more slow, they start to feel like their arms and legs feel heavy, and then their mind starts to feel really light. And I'm saying this kind of how it goes, but it's over a longer period of time than when I'm describing it. And then eventually, at a certain point, we're talking closer to the 40 or 45 minute mark, depending on the dose, they may even they feel kind of disconnected from their body. Like they feel weightless. They feel like they're kind of floaty or floating. And, but again, it's comfortable. It's not scary or anything. They feel very comfortable with it. And then some patients at a certain stage not everybody experiences this, but they may like look at their hands or their feet and they just kind of look foreign to them, and they're like, oh, wow. I know that's my hands, but it doesn't look like my hands,
Right.
like whose hands are those? And it's just a perceptual change. It's not anything more than that. And, but what they found in the research is that those patients who experienced dissociation, that feeling of kind of feeling disconnected and stuff, those patients had a more robust antidepressant response. And so we use that as a general marker, as it's not true for everybody. Excuse me. And so we will slowly go up. And if somebody hasn't had a robust antidepressant response, but they haven't really experienced a significant amount of dissociation, then we'll still, like with the next infusion, we may go up on the dose to a point where we're trying to get them there. But again, gently and making sure that it's comfortable the whole time.
Right.
And sometimes the reason people are mid responders or late responders is because it may take us a little bit longer for us to get to that dose.
And that's why I wanted to make sure we talked about that, is because dissociation, it's not that you're just, let's ramp this up for fun so it's enjoyable for them. That's where actual therapeutic process takes place. That's where they're seeing this reparation of dendrites and so that's why I wanted to make sure we explain that, so it's not like, hey, what's the point of sitting there and doing that? That's where that stuff is taking place according to the research, right? Absolutely.
So they're starting to find this more, that the patients, again, that the level of dissociation, there is a correlation there. But, I've had patients who haven't had significant dissociation, but had great antidepressant responses. So it's not always true. But I have found that as I started to encourage patients to get closer and experience more dissociation, that they were experiencing more benefits. So we do push that, and it just depends on their rating scales. A large part of what I do with the dose and the dose changes is based on how patients are rating themselves. And, but again, the level of dissociation that they feel is, it's highly dependent on the dose. And if their response isn't there yet and we have to go up, then they're going to feel things a little bit more strongly. But that's when you especially want the room to be set up in a way that's going to be comfortable, because that's key. If it's not comfortable, you can't go up on the dose. And
you can't.
Sorry. So you can't really go up on the dose if you're not in a comfortable setting.
Right. Yeah. So the whole point of the way you do things is not only this very necessary professional approach to ketamine infusions, but the whole underlying thing that I've hear you talking about now, and you've told me the entire time, is this level of comfort. And that's the whole process is the number one thing, but then making people comfortable is going to make the whole experience better, which causes them to receive the ketamine treatment better. They have better results. It's kind of just a trickle down effect. Everything, as long as they're comfortable, they're having a good experience, they're going to relate ketamine to positive experiences, which is obviously necessary. When you're using a medication or anything, you're always going to associate what you felt while using it. You're going to associate with that.
Absolutely. And what's important to remember too, even though I focus a lot on comfort, it's not absolutely 100% necessary to get the antidepressant response.
Right.
You can have a miserable experience and still get the antidepressant response. But, and that's why these other clinics that are doing a horrible job are still having some success, because even though these patients are miserable, they're still, like that one patient in the Time Magazine article, it's horrible, but it still works, you know?
Right.
And so they still get the antidepressant response. But with that being said, my dropout rate with my patients is extremely low.
Mm-hmm.
And that's because I focus so much on making it comfortable. And they're going to, if it's comfortable, they're going to want to continue to come back for more treatments. But if they have a miserable experience, they're like, yeah, it's not worth it.
Yeah. And
you know, if it's too miserable, they're like, oh, I'm afraid of going back to that place. And me as an experienced provider, even if it got a little bit, like, because we're pushing the envelope, we're trying to get them a better response, and we're getting closer to that ceiling that they have. I'm highly in tune with patients, and I can read their body language, and I ask them questions that if we're getting anywhere near that, I'm quick to respond and like, oh, let's drop the dose, you know, or hey, let's maybe lengthen the infusion time if we have to make it more comfortable, but yet still effective for them.
Right.
So, and there's some other medications I've been able to use too that will help with allowing them to experience a higher dose and still get that antidepressant response and feel more comfortable with it.
So that's kind of the last thing I wanted to ask you, and maybe this isn't the best question to end on, but the only reason I think is necessary asking is, do you experience people that have bad experiences, or they experience it with you? Because nothing is going to be 100% for people. So I still assume you have people come in and they're like, they have negative experiences, but I mean, it should go, by now we're beating a dead horse by saying this is the top level way to receive ketamine. So if you're like prone to bad experiences, this is the best way to go. You're most likely not going to have it here, but I'm sure still it's not 100% for some people.
Yeah. So,
I mean, you said 86% have a 50%
improvement in their symptoms of anxiety and or depression.
Yeah.
And 40% of those patients actually go into remission. But as far as the experience itself, I would say about, 80% of my patients don't experience at all any negative experience. Mm-hmm. And there's about 10% of my patients who they don't see it as a negative experience, but they don't love it, they don't hate it. They're just like, it is what it is, and it helps me with the depression, and it's great. And then there's another 10% of my patients who they have a harder time with the experience only because they don't like to feel altered.
Right.
So going into the infusion, before the first infusion experience, they're already saying, I don't like to feel altered. Well, how do you experience ketamine if you don't like to feel altered? I mean, you're going to feel altered, right? And so my job is to try and make those people comfortable, even when they're feeling altered and they don't want to feel altered. And we've done it successfully, and we've helped those patients feel comfortable. And then there's the other group of patients who, if we have them at a higher dose and they're normally coming in and they're doing great, there has been a couple times where they were doing great at this one dose, but say something stressful happened, and they were experiencing more anxiety, or they just waited too long before they came back in. If they came back in and we used, the same or similar dose, or even a little bit less, the mindset that you come in with does matter. And if you can use the same or similar dose, and if you're not in a positive mindset, you can experience a little bit more uncomfortable feelings because your mind, especially the second half of the infusion, your mind is going to start to revert back to those things that you were thinking a lot about.
Right.
Your mind just naturally goes back there. And that's why the video is so key, because if you keep that video going, then they can focus in on the video. And I work with them too, and I'm like helping them imagine themselves where the video is, and that keeps it positive for them.
Right.
And in that way, a lot of people have called me kind of like a shaman or a guide. It's funny, because I'm there working with them, trying to make sure that they're comfortable. And I've talked through them, and I've even helped them with breathing techniques and stuff. And, take a slow, deep breath in and counting and helping them really through it and making sure that they're nice and comfortable. If they're trying to push the dose. Now, if they're not trying to push the dose, then they're generally like, this is easy. This is super easy. But if they're trying to get more benefit and they're increasing the dose, you run the risk of getting too close to that ceiling, and they can experience some confusing feelings or maybe a little bit of uncomfortable feeling if you let it go too long. But for the most part, most of my patients really only feel like maybe a little confused, because we usually nip it in the butt before it continues to become uncomfortable.
Right.
Because again, I'm in the room, and checking in on them, making sure that it's comfortable. So is it always perfect? Not always, but I would have to say that we do it at our clinic far better than anybody else, because I have the experience to read people's body language. I'm constantly checking in with them, and we're making sure that it's comfortable. If we're not pushing the envelope, it's easy because we're not anywhere near that ceiling for that patient, and it's just an easy, smooth ride. But everybody's a little bit different. And so if you can't come to our clinic, you definitely want to go to a place where that's their focus too, is making sure that you're comfortable. And I hope that they are able to do that.
Well, if your place isn't doing that, share this podcast episode with them.
That's
so
right.
They can step it up.
That's right. I've heard some strange things of patients who are going out of town, and they were moving, and they're like, "Hey, I found this place," and there's like sketchy practices going out there. So you people really do
your research,
need to do your research on who's the provider, who's actually giving it to you, and what the circumstances are like. And so yeah.
And so if you're, before we end, is there anything you feel we haven't covered that you want to go over that people know about your clinic, the process? I feel like we've really dove into what to expect if you're coming to your clinic, what they should look for in other clinics, benefits of ketamine. But is there anything you feel we left out?
I guess the only other thing is, since I'm not, as an anesthesiologist, I'm not a mental health provider. I don't try to pretend to be a mental health provider. I make that very clear to my patients that I am providing them a treatment for their mental health condition, but I am not trying to give them counseling regarding their mental health. I am simply providing this treatment to help them get relief. And so what I do before I start treating patients is I reach out to their own mental health provider, and I speak with them and confirm their diagnoses and just establish that relationship. So in case there's any reason that I can reach out to them again during treatment and consult with them, and they know the patient really well, and they're continuing to meet with the patient. So you have the anesthesiologist who's providing the ketamine treatment, and then you have the mental health provider who's monitoring the patient as they normally are.
Right.
So that is the ideal situation.
And correct me if you don't do this anymore, but when I came to you for ketamine, I didn't currently have like a person that I was seeing, like a psychiatrist or anything. So I just went, you just have a requirement that I went to get basically, I'll let you explain it, evaluation, so that you could have someone to coordinate with, that it was an actual confirmed diagnosis. And
absolutely. Yeah. So for patients who have, given up on psychiatry, and they stop going to their psychiatrist, or they stop going to their psychologist, and they've been away from it for a year or 6 months or longer, they don't have anybody anymore, but they want to come in and get treatment. What I offer my patients is, there's a psychologist who I work with. Her name is Megan Lewis. She's amazing. She's super nice. My patients love her. They go meet with her, and she does an hour-long evaluation with them, and she's very familiar with ketamine. And so she's able to do her psychological assessment, and then she passes that on to me. And then from that point forward, we'll go ahead and continue treatment based on her psychological assessment. And if there's anything else that we, again, I need to communicate with, and I reach back out to her, and then the patient can go see her if we need to do that. But I always encourage my patients, especially when we're starting treatment, to get engaged in psychotherapy, whether it be with Megan Lewis or whoever they reach out to. And so usually patients are starting to establish those connections, and then I get permission to talk with them as well once they get those things going. But I think there needs to be a collaboration between the anesthesiologist who's providing the treatment, because they're the most qualified to do it, and they're collaborating with the mental health provider who is also monitoring the patient and able to provide the advice that they need from their mental health side. And that's the ideal treatment. I've had several psychiatrists tell me that is the ideal model for them. And I've had several psychiatrists refer patients to me. I've even had a psychiatrist come to me simply because I do it that way, and they're very comfortable with that model. Mm-hmm. And so that's another, I guess, requirement that you would want to look for.
Perfect.
I've had some psychiatrists tell me that their patients go to a place that is run by a psychiatrist, and the psychiatrist does his own evaluation, doesn't ever reach out to the mental health provider of that patient who's known him for years, and just goes ahead and starts treatment, and doesn't realize that that patient may be withholding information or whatever, or there's stuff that they don't get and could be useful in understanding before they started to treat that patient. So even if you're a psychiatrist, I think the psychiatrist should be reaching out to the patient's own mental health provider first before they initiate treatment. Yeah. Just so that they have that understanding there. But anyways, I think that that's important, and we didn't really discuss it. And then also some of the indications that we didn't really talk about were like, I've had patients come to me who were at the end of the rope, and they, were about to be admitted to an inpatient long-term housing situation, and we were able to get them better and more stable on ketamine, and they've continued to be stable. I've had patients who were also having eating disorder issues, and they came and they also had depression and anxiety. I treated them for their depression and anxiety, which in turn helped them with their eating disorder as well. And then I've also treated patients who just simply didn't want to take antidepressants. They had tried them, didn't work for them, they're not on them, and they decide, I want to go ahead and get rid of this, but I don't want to take a daily medication and deal with the side effects. And excuse me. And so I've treated those patients, and I treat some very holistic patients who like alternative medicines and stuff, even though ketamine itself is not an alternative medicine. It is a medication that's FDA approved. Those people that are into not taking medications, ketamine is a wonderful option for them, because, once they receive the 6 treatments, they don't need to take a daily medication. And at most they need 1 treatment every 4 to 6 weeks. Well, that's ideal for them, not to have to take a daily medication, not to deal with the side effects. So there's a whole spectrum of patients that I treat. And I treat, I didn't mention it either, but I do treat patients with bipolar too. Okay. And some of the patients are concerned about, is ketamine going to induce a manic episode? And in my experience, I have not seen that. And so I've had several psychiatrists refer me their bipolar patients, bipolar 1, bipolar 2, and they've had great success with ketamine.
Awesome.
And I haven't seen any documented, definite, gave ketamine and they went into a manic episode. It has just not happened. I'm not saying it can't happen. It's a theoretical risk, but I've treated a lot of bipolar patients. I've treated over 200 patients, and I just haven't seen that happen. Yeah. And
the only other one we didn't, and forgive me if we did talk about this, but migraines as well, right?
Yes, that's another condition we treat. That's right. Yeah, I've treated patients for migraines, and that's a little bit longer infusion. It's a 2-hour infusion. And we do ketamine, and we also add magnesium to the infusion for that as well. But yeah.
And I mean, I feel bad that I waited till the end to bring that up, because that is huge. I mean, that aside from mental health, all those super important things, migraines is one more thing that people are like, I've tried everything.
Mm-hmm.
And as someone who has migraines and luckily has a lot less of them now after I found out the things that work for me, man, if you've tried everything and you haven't tried ketamine, I highly recommend you look into it as a treatment option for you, because, man, I just feel for people that have migraines. They're the worst. And just to know that this is an option for them as well is huge.
Yeah.
So,
And I've treated patients who were just not getting any benefit from the neurologist, and they had tried everything, and we were able to reduce the intensity and the frequency of their infusions. Not take them away, but reduce the intensity and the frequency, which is huge, because all the other things, Botox, all the other medications that's been on had not been able to reduce them.
Yeah.
So,
well, that's huge. I mean, there's people that literally have migraines every day. And if you're like, you're still going to have migraines, but what if we cut that in half?
Yeah.
You know, they'd be like, fantastic. Like,
it's huge.
Like, I mean, for me, I remember when I had them bad, like multiple times a week, if I woke up without a migraine, I was like, awesome. Like today's going to be fantastic. You know, you get to that point where you just wake up without one and you're pumped, you know? And so, yeah, I'm stoked. That's just one more thing that people can come to for the ketamine treatment. So,
yeah.
And for people who have migraines, for people who've had them long enough or have done their research and know the benefits of magnesium. So the fact that that's a part of the treatment plan as well. A lot of people are supplementing magnesium or doing magnesium soaks or whatever. I've done those and they help. And so the fact that ketamine is coupled with the magnesium it's great.
Yeah, and another thing that I was thinking of that people ask is the age range. Like, what is the typical age range that I treat? And there is no official age range, but the patients that I typically treat, their ages are from 18 to 65. Now, with some exception, I'll treat some patients older than 65, and with some exception, I'll treat some patients younger than 18, but not really younger than 16. So it's 16 to 18. But again, those patients who were 16, 18, they have had to have tried multiple, and I don't just treat anybody. They have to have tried multiple antidepressants, because we don't know the effect on the developing brain. But a lot of these patients, when they're coming to me, they're at the end of their rope. Those 16 and 17-year-olds, they're just at the end of their rope, literally, and they have nothing else. And not treating them with ketamine is worse than the risks of treating them and not knowing any potential long-term risks. But I have treated several 16, 17-year-old patients, and they've responded well with no side effects.
Awesome.
And I've also treated patients older than the age of 65 as well. But they have to be healthy over the age of 65. They can't have too many medical problems. And that's just because when you get over that age, you start to have, just as part of getting older, you start to have more problems with your heart, your lungs, and other parts of your body. And it takes a little bit longer to recover from the ketamine. And I guess that's another thing as far as the recovery from ketamine. What is it like? So after the infusion, the half-life of ketamine is 2.5 hours. And that's important to understand, because some people think, oh, the ketamine is in your system for like a week. No, so in 2.5 hours, 50% of it is gone out of your body. And in 5 hours, 75% of it is out of your system. So it's not that ketamine is hanging around in your body. What ketamine is doing is it's going in and it's initiating all these reactions in your mind and your brain, and it's triggering these, other things that promote the growth of the dendrites that trigger the release of BDNF and all these other things that we're not entirely sure that it's doing, and then it's gone. And that's why we do additional treatments, because again, the next treatment we go in and it triggers, all these reactions to take place, and then it gets out. So again, that's the beauty of ketamine, that it's not in your system. There's very few side effects from it. And so it's, I was just attending a lecture given by a professor at Vanderbilt, and she was talking about the mechanism of ketamine, and they said they are treating ketamine like the Holy Grail for antidepressants, because it works fast and it has a long-term effect. and they're still trying to figure out exactly how that works. They're still just bewildered by it. But if they can figure that out, then their hope is they can develop more drugs to do those same things as well. But right now, ketamine is it. Ketamine is the only thing it's working that quickly and having a long-term effect. And again, I feel so grateful to be a part of this clinic and helping people in the way that we're helping and saving lives. And it's been an amazing boost to just my overall satisfaction. And it's one of the reasons I went into medicine, is to help people. And this has been more rewarding than anything else I've done.
Awesome.
Yeah.
Well, Dr. Drew Belnap, thank you so much for your time, man. I really appreciate it. I know you're insanely busy. Aside from work, you've got a great family. And so I just appreciate you taking the time, and I know our listeners will benefit from this. And so it goes without saying, I've said this 100 times, but I'm a big supporter of what you do. Really appreciate it. The integrity behind the type of practice you've created. And so anybody listening, if you're in the Southern California area or you make it here, or you can make it here, this is the number one place I recommend you look into. You reach out to Dr. Drew Belnap, his clinic. So it's called the South Coast TMS and Ketamine Clinic. It's in Encinitas, California. So highly recommend it. And if there's no way you can get here, Dr. Drew Belnap's provided more than enough information to know what to look for and what to research. So I really appreciate your time. Thank you so much.
Thank you. I appreciate it. Thank you.